We're live. Hello, everyone. This is Jen Gardella. I'm with the ever lovely Kim Everett, who was just explaining to me her great holiday deals and fun family festivities and some new things that are going on around BCHIP. Kim, welcome to your own Facebook Live.
Well, thank you. And thanks for hosting us here today, Dr. Gardella. I appreciate it.
So you were just explaining something very exciting that happened with the task force meeting last week. Go ahead, let us know what's going on in Bucks County.
Yeah, so in true BCHIP fashion, as we identify problems in the community and gaps in healthcare, we try to address those gaps. So one of the issues that was recently brought to our attention by our healthcare systems is the increase in acts of violence against healthcare staff. So not just nurses, but techs or paramedics or and really there's been significant increases, and all of our health systems here in Bucks County and truly many of them across the country are showing similar data. So we wanted to bring together some of the key stakeholders. We had a meeting last week with our local police departments that respond to those hospitals, and we had a meeting that included the Bucks County DA's office. Matt Weintraub was extremely responsive and his team there. And so we were able to bring folks together to talk about the issue and identify some opportunities to try to do good work together moving forward.
Okay, so we have to back up for a second. So when we're talking about violence against healthcare workers, are these out of control patients? Are these already like people that get to that level? Are they there for a mental health crisis? Are they experiencing some sort of overdose, or are they just frustrated? Like, what happens to someone to cause them to do that?
A lot of it is acting out of frustration. So first of all, the majority of it is patients. There are a few healthcare or visitors, I should say, that there have been accounts of, but primarily it is patients. Yes, some of them, and I would say most of them, are patients that are experiencing mental health challenges, but there are some that are just out of pure frustration. So when we have those long waits in our ER and they could be uncomfortable or nervous or scared, and people really do act out and they get extremely frustrated. So all of our hospitals have had de-escalation training, and some have, they've had different ones, or some have had similar, but they are trained to try to de-escalate that situation, but it doesn't always work.
And so healthcare workers are being harmed. So what did y'all come up with as a good solution?
Well, what we did, and what's really nice about BCHIP is each hospital is able to share some different things that they're doing. So for instance, one hospital has their security guards actually just do what they're calling rounding. So they're going to the various waiting rooms of the hospital and just talking to patients and saying, how are things going for you? And just really engaging with them. And if they do find somebody that's very frustrated, trying to use those de-escalation skills. So just really that personal contact, they're finding helpful. So that was one example that some of the other hospitals felt might be beneficial. Another one of our health systems has invested significantly in technology, and all of their colleagues have a button technology on their badge that if they feel they're at risk, they push this button and it alerts for an immediate response from security and others which in the system, and it identifies immediately where they are. And so that's another piece that they're implementing. So each hospital shared, several of them have put in metal detectors, particularly at their ER entrances, just to try to address any concerns about bringing weapons into the ER. Most community members have responded very appropriately, because we do have policies in our health systems that you cannot bring in a weapon to the hospital. They'll secure it for you and they'll lock it appropriately for you, but they just don't want weapons in the healthcare system. And so several of them have done that through the ER, not all of them, but again, all of them shared kind of what they're doing and the challenges they've experienced around it, what challenges they haven't had. I think most people would think if you tell someone you can't bring your weapon in the hospital, they expect a lot of people to act out and to be concerned. And most of the hospitals that have had the metal detectors have said that they didn't have that response, that most people were very understanding and accepting. And so having those conversations was important. But what was also really neat was talking to the DA's office and allowing them to provide loop closure, like for some of the cases they've had, because what I found really interesting is that healthcare workers typically don't want to press charges either. Because it's not the hospital that presses charges, it's got to be the staff member themselves. And so, yeah, they're like, oh, I don't want to have to miss time, or I don't, it's just because they were sick, or they tolerate a lot of things that people in other workplaces would never tolerate. And so I found that interesting. So they have to be willing to press charges.
Wow.
Mm-hmm.
Right. You're blown, like mind blown right here. This is a true problem. Do you think, wait, I have a question. Is it okay?
Mm-hmm.
So do you think it's related at all to this idea of staffing crises that we're having with not enough workers in the hospital, or more people in the waiting room, the ER for more issues? What do they find that it is?
Well, that's what the task force is going to start looking at, to be honest. I think
Okay.
that we can't act like it's not related, but for the most part, you remember, while we are challenged with staffing a lot, all that staffing isn't always challenged with just nursing. We need, and it kind of comes back to the big picture. Everyone says, well, we don't have affordable housing in Bucks County. Well, they're right. We don't have affordable housing. And every time we try to come up with projects for affordable housing, people don't want those neighborhoods in their community. So that's, again, that's their opinion. However, we can't pay everybody in all of these jobs in all of our different systems enough money to live in Bucks County right now, right? You have to be able to make $20 an hour and be able to live comfortably in Bucks County. And so maybe it's not always just nursing staffing that could be the challenges. It could be, who's cleaning the rooms, who's delivering the food, So we need people that can afford to take those jobs and live in Bucks County to meet some of those staffing demands. So does that contribute to some of this? Possibly, certainly. That makes sense for sure. But I think what's interesting too is as we identify staff and they don't want to press charges, maybe it could be because of the impact it has on them personally, right? It might mean days away from family that they can't afford to, take off and those kind of things, which is great because we had Nova at the meeting, and Nova shared how they have advocates that can help them and identify resources to support them as they go through that process. And interestingly enough, most of the hospitals do not connect their employees with Nova when they experience violence. And so that was a huge kind of epiphany at the meeting, that they can access these resources through Nova that are independent of their employer, right? So that was kind of nice too. They're hoping that people will take advantage of that. And then the other thing I found pretty interesting through the work is that it is a felony to commit a crime or to commit an act of violence against a healthcare worker. And so trying to make sure that it is the necessary information is taken or is shared by the police, or that the police are contacted so that the person can be prosecuted appropriately. And that's another reason why the DA was included.
Right. But it starts with the worker who was harmed needs to be the one to help to press charges.
Mm-hmm.
Wow. I had no idea that this was going on.
Yeah.
Sadly,
it is.
I know that you guys are partners, obviously, with all of the hospitals. Now we have the DA involved. We have Nova involved. Is everybody appointing someone for the task force, and how often is it meeting?
So we're trying to determine next steps. I'm not sure whether we're going to bring the whole task force, because there was 36 people in the room. And
That's a big task force.
It was a big task force. And we met for an hour and a half and shared a lot of really good information. I'm going to kind of go back to some of the healthcare providers now and say, do we want to keep the task force moving forward? Do we want to identify subcommittees, I think, that work around topics, particularly around data? We realize that even within the health systems, we don't have great data, because the colleague health is capturing information, right, on people that may have missed work because of physical or mental challenges associated with an assault or with an act of violence. But if somebody doesn't report it to them, maybe it's reported in their system where they track incidences, but it never got reported to colleague health. So that's separate data. Or maybe it just got reported to security and security didn't report it in either one of those other systems. So even within the healthcare system, we don't have good data on exactly how this is impacting the health system itself. So I think what we will do is look at some of the issues that were identified and develop some subgroups around that and have some of the members that were there take ownership and leadership of that work.
Wow. And what do you think are going to be some good outcomes of this? Like, what would make this task force successful?
I think improved communication between the police, the health systems, and the DA's office is definitely going to be something that comes out of it. In fact, all the health systems already asked the DA's office to come out and do trainings for their colleagues, which
Good.
I was thrilled to hear about. So just increased communication is going to be key. I think better data will be a good outcome. And ultimately implementing what we identify as some best practices, looking around not just locally, but at other parts of the country to say what are other health systems doing that they have actually seen improved data or decreased acts of violence in their health systems, and what we could implement locally, and if need be, collaboration around funding to do so in all 6 health systems instead of just one trying to navigate that independently.
Right. Wow. And also, I would imagine there's a HIPAA issue because you can't flag a name in a system as a incident provoking individual. That, I don't know what the correct word verbiage is, a patient. I don't know. And so people then can go to visit a different ER maybe, and they're not, I'm just going to use the word flagged.
Well, what's interesting is because of the requirements for health systems, they have to treat somebody in an emergent situation.
Right.
But they are, a couple of the health systems that were represented are flagging patients and saying, we're not going to admit this patient. Like, they have to take care of them and stabilize them. So don't misunderstand. They're never, ever going to turn a patient away. But if this is somebody who's medically stable, but say maybe needed an admission, to be monitored, if this is someone that's been a problem before routinely, they can refuse admission.
Okay.
And I don't think that's really where they want to go with this, because I think that just bumps the problem to somebody else. But it was interesting to see that some health systems are considering that. So having that conversation about, well, what do we do? Because if all of you start red flagging the same patient, where's this person going to go? So
yeah,
it was interesting for sure.
And just one of the things that I'm always so interested or fascinated about BCHIP and you guys, your importance is that there was a need, right? That was identified. And you guys were the ones to bring everybody to the table because they're all your partners that are involved. You're like this unifying body that, calls everybody to the knights table there.
Exactly.
What was the catalyst?
Well, I think there have been a few circumstances that the hospitals were really challenged with, and they want to do, a better job by their colleagues. I mean, not better, they're doing the best they can, but they really care about their colleagues. And when they bring it to my attention, and the nice part is BCHIP has all those existing relationships. And boy, when I reached out to Matt Weintraub, I mean, within like an hour, the answer was, let's do it, And so because we have those established relationships with these community partners, it makes it that much easier for us to be that convener and to pull those people together.
That's a great word, the convener, to make healthcare in Bucks County better for everybody, because that certainly would, right. Wow. I had no idea that this was an issue.
I didn't either until I started talking about it. And I was like, oh my goodness. Of course, my initial response, if I'm honest, was, oh my gosh, another gap. But that was good. We were excited, right? We're excited to be able to have those relationships and bring that work forward and support our health systems and our community partners on something that's really important.
Whew. Okay. Well, this was a rather heavy topic to discuss on our biweekly chat, but a really important one for people to understand that there's a lot of issues that our healthcare systems are facing in just keeping people safe, right?
Amen.
You go there for care. You don't expect there to be those kind of issues. So thank you for bringing that to everyone's attention. And why don't you let everybody know if they want to get in touch with BCHIP, how do they do that?
Absolutely. So BCHIP is available on our website, which is bchip.org. Lots of good information there. Or you can always reach